we look at what's happened here in the last 5-10 years or so, what kind of advancements have we made which will then make it less invasive for a patient? Because let's face it, for a lot of patients, it can be a simple surgery, but it's a little frightening when the doctor brings up that word and talks about having to have a surgical procedure.
Yeah, I would say so. I would say that in making that determination is that there's of surgery, let's say, there's always a risk-benefit ratio, and in the past, sometimes the procedures that we would do for you would be, would be fairly invasive, and the risks may be higher, and also the inconvenience in your life, the recuperation, may be longer. Where minimally invasive surgery, I think, has changed a lot of that is that in many ways the risks are lower, in some cases, I would say, and also that the recuperation is shorter. So when you're getting to where that risk-benefit ratio, the benefits now are starting to maybe outweigh those risks predictably, then it makes it a little bit easier decision, I think, and less, let's say, less time-consuming in your life. So those are things I think where minimally invasive surgery has really changed that scale.
I want to make sure we talk about arthroscopic surgery here, because I've had it.
Okay.
I've had it a few times, as a matter of fact, on my knees, and it has been brilliant when I've had it done.
I would say that with arthroscopic surgery, which has been around now for a while, that the way the surgery is done through very small little incisions. So you would have, let's say for the ankle, there'd be 2 small incisions on each side of the front of the ankle, and we would go in with a scope or an arthroscope, as you can see, and within it you have a camera light, and everything is somewhat magnified. So it's almost as if you've taken yourself and you've jumped inside the joint. Let's put it that way, and you can get to areas much easier in the front and in the back of the ankle through the scope than you could even doing an open procedure.